Good morning. We're going over drug administration, and you'll see here we have a self-administration and medication institute for safe medication practices. It's a free booklet. Go to this website, and it's a good resource to refer back to. We're going to go over the forms of and the routes of drug administration. Forms and routes of administration, you can have it sublingual, buccal, which sublingual under the tongue, buccal is in the cheek area, oral is the most convenient in the form of tablets, capsules. If you're patients who are vomiting or have a lack of gag reflex, who are comatose, you would not administer medications in that form. But otherwise, you could do that. Nurses play a significant role in preparing administration medications, teaching, evaluation, their patients' responses, and the drugs they administer. And now, patients must receive adequate training. I can't emphasize that enough, like we have been going over. Self-administer medications upon discharge. Therefore, nurses must be knowledgeable about many of the aspects of the drug administration, including the pharmacology, pharmacokinetics, safety practices, legal aspects of the medication administration, along with the anatomy and physiology and dosage calculations. Now, a variety of forms and routes are used in these drugs, including sublingual, buccal, it's like oral, which is tablets, capsules, liquids, suspensions, elixirs, and then the transdermal, which is either a patch and you'll see various forms of medication will be delivered that way. Topical instillation, which means drops or sprays, inhalation, nasogastric, and then gastrostomy tubes, like G tubes, suppositories, and parenteral. Now, oral medicines, you have just examples here, forms. You got instillations for the eye, and then the eye drops. And so you have, hi, just a second. And an eye ointment, you want to lift out the lower lid and run alongside the lid, not touching the sclera. Eardrops, as we administer the eardrops, as you learned in skills, you'll want to pull the children's ears back, and then the grown-ups, you want to, and our older children, you go up. Now, with nose drops or nose sprays, always remember to administer laying back if it is the nose drops. And with the sprays, you don't want to stick it entirely up the nose. You want to have the spray effect. So make sure that you don't do that, because it'll could damage the nostril. Now, energic coated medicines and time release capsules must be swallowed whole to maintain the therapeutic drug level. If crushed, you will actually a toxicity. You can cause a toxicity and lead to a potential fatal overdose. Administer irritating drugs with food to decrease the gastrointestinal discomfort. And now, with nasal gastric or G tubes, or NG tubes, always check for the proper placement and residual before administering drugs. Place the patient in a high Fowler's position or elevate the head at least 30 degrees when doing that. Now, with forms and routes of drug administration, as you see with the rectal suppositories, you want to make sure that when it's placed, they place them on the side and keep them at that sideline position for a short while, so of course it can dissolve and won't come out. Now, here with parental drug administered, you would see that's intradermal in this way, or you can have the sub-Q or IM. Now you can see here with subcutaneous the sites that you most commonly use. Now, on the intermuscular, the action sites and equipment techniques, we've gone over this. This is Z-track, or you look for the iliac crest and administer. And then remember to leave it in the 10 seconds and then pull it out. Remember, with the intermuscular and the deltoid region, always look on the upper region, and then and look at the landmarks there. Now, when in intermuscular, in the vastus lateralis, you want to make sure you look at the greater trochanter of the femur and not get it too high where it would disturb the sciatic nerve. Here you can see an illustration of the Z-track as we've demonstrated in clinical skills. You can see that where you pull the skin off to shift the layer to where it will trap the actual medication in the muscle layer. Then we have the intravenous drug administration right here, and you can see the action site, equipment, and technique. And depending on the drug is really on the placement. You usually don't, you see in an emergent situation where they'll use the anticubital you will usually use the forearm and not the wrist if you have something that is being delivered that could be necrotic, and damage the veins, because you'll have a short stay. There's different medications that actually you can see it's on the hand. You will have a lot of different sites. We'll practice that. Now, when you're in the needs of pediatric patients, you have stranger anxiety. So some bigger hospitals will have a OT or PT come in and come and do play therapy with the patient when they're hospitalized and they have an illness or injury, viewed as, because they look at it as punishment. That's why you never want to have the parents step in and hold their child down, because it'll just increase that fear factor and cause big confusion. And I see a lot of times that parents are asked to do that, and that's the wrong procedure. You don't do that. You don't want them to have. You want it to be a good experience, as good as it can be. Now, now I want you to know the elixirs are sweetened, and alcoholic liquids are used in preparation of oral liquid medications. You want to read all labels for dilution, shaking constitutions, because suspensions are liquids that have small particles that will end up settling. All suspensions should be shaken. And then dermal medication is stored in a patch form, placed on the skin, and can be absorbed through the skin, having a systemic effect. You want to always rotate sites and always wear gloves, because it could be a nicotine patch, and you don't want to get that absorbed through the hands. Fentanyl patches, anything that could be absorbed in the skin, you always make sure you wear gloves. But you have topical medications, most frequently applied in the skin by painting, you say, actually spreading it, the medication over an absorbent area, which is usually the wrist, and leaving it in the area exposed, applying a moist dressing, or leaving it area exposed to air, depending on the porosity of the skin. Children have higher porosity, and medication will absorb faster. Meter dose inhalers, they're devices are used to deliver a number of medications for asthma, bronchitis, drugs. You can go through inhaler or a nebulizer. And it actually, most everyone knows that the nebulizer is a device. The liquid contains a little cup holding the liquid, and connected to the tube that creates an aerosol, and a mask worn over it. Usually that's recommended for children and elderly patients, and usually you'll see it delivered that way in the hospital. Check for proper tube placement before administering medications via nasogastric and G tubes. And like I had said, make sure with this, when you're delivering it G-tube, that the medication can be crushed, because it needs to have another medication ordered that is crushable to be able to deliver it via G-tube. And then medications administered as suppositories or enemas, you just want to make sure they're faster absorbed. It's usually given for people that are unable to swallow, or if they're vomiting. Now, you don't want to give a suppository to someone that's having diarrhea, but you want to. It is a quicker systemic absorption rate. Now, vaginal drugs are used like a suppository, foams, jellies, creams, or even you'll see some Cytotec or different medications that will induce or soften the cervix, that will actually look like a tampon. You'll deliver medication that way and ripen the cervix, so they will induce labor. And now, remember to advise a patient, like I said, for a time period to allow the medication to absorb. And then methods of the parenteral administration: intradermal, subcutaneous, intramuscular, like we saw examples of, Z-track technique, intravenous, and the different medications. Do not use the dorsogluteal for IM injection sites. Demonstrated exact location. Just like I said, it will cause a sciatic nerve damage. In children, give the developed muscle in the azovetrogluteal site. You'll want to IM medications, know this, are given for rapid absorption. They should be given into the deltoid because of the increased vascularization there versus the gluteal. It is less vascular. Anticipate parents' developmental needs when educating. Then we'll have advances in drug administration therapy, continue to advance the safety, increase accessibility to sites, promote patient mobility, and improve patient adherence. Current technological advances found in many facilities today include computerized order entry, an electronic medical record system, electronic medication administration records, barcode administration records, smart pumps, the point of care technologies. These advances have been implemented to help reduce medication errors and improve the delivery of safe and effective patient care. So, as we said in the last chapter, assessment, nursing diagnosis, planning, nursing interventions, and then the evaluation. All of that, just learn it over and over and over, and know the practice questions and the NCLEX questions. Just keep reiterating. This helps you along and gets you prepared for what's to come. The big thing is safety. If y'all have any questions, please email me.